Thank you, Mr. Chairman, and thank you for holding this hearing. I know it's been 12 long years. It's been long in coming, but I'm glad we're doing it today, and I want to thank all the witnesses for being here today. This is an interesting phenomenon that we're witnessing in this committee today. You know, when there's a problem, the first thing you have to do is everybody's got to agree that there's a problem. And that's not always how it happens in Congress. And this is the first time, I think, since I've been on this committee that we've had all of the witnesses, both Democratic witnesses and Republican witnesses, here in agreement that climate change is real and climate change is a problem. So there may be some of our colleagues who aren't there yet, but the fact that you're here and all in agreement that it is a problem and we need to do something, I think is a very important step forward. I know that climate change is real, and I know the consequences of climate change aren't hypothetical. My state of California and my district in particular has been just devastated by fires over the course of the last 4 years. The Mendocino Complex fire, 459,000 acres, $267 million in damages. The Carr fire in Shasta County, right outside of my district, 1,000 homes lost, $1.6 billion in damages. The Thomas fire, 280,000 acres, $2.2 billion in damages. The Tubbs and Atlas fires in my district, sadly, 44 people died in that fire. And Mr. Wright, I know you're familiar with this because your family lost homes in Paradise in the Camp Fire, $16.5 billion, and worse yet, over 85 people dead, and I understand some still missing. It appears that these fires may be the new norm, and we do need to take action and need to take action quickly. Dr. Jha, you talked about the medical impact of climate change. There's also a medical impact of these fire disasters as well. Smoke inhalation, allergy exacerbation, the trauma that's caused by this, and the PTSD. There are kids in my district that if the fire siren goes off, they absolutely melt down. And there are adults that are in that situation as well. Those are costs that we need to somehow figure out how to deal with. And the fact that every time there's a fire, we either lose a hospital in that fire or hospitals are shut down and patients have to be evacuated, sometimes multiple times during a fire. Can you talk a little bit about the total cost package to healthcare?
Yeah, so, Congressman, it's a fabulous question, and let me make a broader point about what wildfires, what Hurricane Maria, what all of these storms have taught us, and these events, weather events, have taught us, which is while there is a direct effect right away, and we see it in the number of people who lose their lives in the fires, the big health consequences and economic consequences from those health effects come in the days and weeks and months that follow. What we know from the wildfires, to speak specifically to your issue, is that you get a substantial increase in respiratory diseases, asthma, COPD. You see more emergency department visits, more hospitalizations for heart attacks, strokes, heart failure. These things are incredibly costly to people in terms of their health. It's incredibly costly to the healthcare system, to Medicare, to Medicaid, and private insurance and businesses that pay for all of that. The disruption that comes from hospitals burning down, but hospitals are no good if the doctors and nurses to staff them aren't there, and they get displaced. And when people get displaced, for those of us who are healthy, it may not be a big deal to be displaced for a short period of time. But for people who are chronically ill, it's a huge effect.
Thank you very much. I believe this is at the point where we need to be big and bold in what we do. But at the same time, I think we need to take some incremental steps, and I think we can do both at the same time. So, Mr. Halstead and Mr. Wright, I've been very active in incremental efforts to use the tax code, to green the tax code. Congressman Reed and I have a couple of measures. Do you agree that we need to be doing both?
Yes, I think we both agree that we need to do both. Maybe you could talk about the, well,
You just,
I will talk about
just
the
a yes,
mechanism.
because we're out
Yes.
of time, but,
Absolutely.
or a no. So you're both
Yes.
yeses? All right, thank you very much. I yield back.